Hey, you guys, this week I wanted to talk to you about a few of the abdominal issues. A lot of my review students run into this. I remember being in this position and, just trying to get them down to the actual location, how they present themselves, how you treat, etc. And the four that I'm talking about with you this week is cholecystitis, appendicitis, pancreatitis, and diverticulitis. All the itis, right? But I want to get into those because it's so easy to get hung up or mix up which sign should you do to test this, thinking about the location of it. But I got all the tips and tricks to kind of help you with that. And we're going to work through it this week because I want to ensure that you have an understanding, because I like to always tell you guys to make sure you know your why, and then I prepare you so that you can succeed on exams as well as in practice, okay? But I want to make it easier for you to study and retain this content. So follow me as we get into this cholecystitis, appendicitis, pancreatitis, and diverticulitis. We'll start with cholecystitis, okay? All right. Okay, so cholecystitis. I tell you guys to make sure you know your med terminology, but itis meaning inflammation. We know what cholecystitis is. It's inflammation of the gallbladder, but that itis is letting you know something is inflamed, right? So if you get stuck, when in doubt, do your med terminology. But again, cholecystitis is the inflammation of the gallbladder. Now here is where I tell you to know your why, because my nurse practitioners, as we are preparing for boards, I tell you to study in the fashion, and I always try to teach you in this way to make it a little bit easier to retain: assessment, diagnosis, the evaluation, and treatment, because those are the things they want to make sure that you know on exams, on either of the exams. So I like you to start to formulate your mind in that fashion so that it's easier for you to excel. But again, I prepare you for exams and practice, because in practice you're thinking the same way, right? Assessment, how are they presenting to you? How are you getting your diagnosis? How will you evaluate this patient? How will you treat them? So what is your plan? And that's all it is in our practice, right? So that's what they're testing you on. That's how you need to gear your mind. That's how you need to think always. So again, our condition, our diagnosis, we always start here, cholecystitis being that inflamed gallbladder. Now we need to know why so we can fill in the rest of those blanks. So why is the gallbladder inflamed? So there's various things that can cause that, but you need to have a true understanding of why. So that the gallbladder holds the bile. You have your ducts, your cystic ducts, your bile duct that it goes through to the small intestines, correct? So when the gallbladder is inflamed, typically there is something blocking those ducts. So the bile is building, and I'm not saying, I'm country, I'm saying bile, B-I-L-E, not bile, bile, B-I-L-E. But it builds up in the gallbladder, causing it to be inflamed. So a part of our journey in practice is to figure out what's causing those ducts to be blocked. Is the gallstone? Is it scarring, from trauma, etc.? We got to figure out the why. But how do you think someone may present themselves if that bile is beginning to sit in that gallbladder and build, So they may have intermittent pain, severe pain, cramping-like sensation. They may be nauseated. They may vomit. But that pain is in the right upper quadrant. This is commonly where people get hung up. They're like, is it right, left, lower, etc.? And I always say, hey, bring it back. Take it back. You know your anatomy. Where is the gallbladder located? The gallbladder is located in the right upper quadrant of the abdomen. And on tomorrow, we'll go through those quadrants again. I'm going to take you back to the basics, let you see it, go through it to help you retain it. But I just want to get to the foundation of it today. So again, we're thinking back, the gallbladder's in the right upper quadrant. That's where the pain will be, okay? So again, that's how they'll present themselves. So that will be the assessment that you have on that, right? So you're assessing them. They're coming in. They're complaining of that abdominal pain. Oh my goodness, I've been having severe pain for the past few hours, and then it'll kind of relieve itself and it'll come back. Or they may say, hey, after eating, I have this pain. Why? Again, think about it. When you eat, your gallbladder contracts and squeezes the bile on through the ducts to the small intestines, right? So eating can cause this pain to initiate, right? Because the gallbladder is starting to work. If you're eating those fried, greasy foods, that's going to make the bile more concentrated. So the gallbladder is going to have to work a little bit harder, right? So I'm a visual person, so I like to think of it kind of like, think of a water balloon. And you think about it, hey, it's open, you're filling it up with the water to the hose, right? So as you're filling it up, you have now tied it off. So we're going to think of that as the gallstone or whatever is causing that to block that duct. So now the water, if you think about the water has filled and filled and filled, that is going to stretch. So that's causing pain. That's your gallbladder. And just like your gallbladder, if it continues, it can rupture. The balloon can pop. Fried foods, I think of that, putting like oil in there. It's not, that water doesn't flow through the same anymore, right? So again, it's making that gallbladder work a little bit harder with those fried, greasy foods. So let's start back from the top, because I know I just gave you a lot. Cholecystitis is the inflammation of the gallbladder. Something is blocking these ducts. It is not allowing the actual bile to flow through to the small intestines. So the gallbladder is retaining this bile. The more we retain, the inflammation may occur. If it sits for too long, there may be an infection. These are additional factors that we have to review as we take care of this patient, but I'm just giving you the basics, okay? So with that understanding and that foundation of the why, now we know that, hey, this person may present with pain. They'll have that intermittent pain. They may be nauseated. They may be vomiting, They may have more symptoms after eating, especially if it's fried, greasy foods, etc. So next, how do we diagnose, right? So that's the next step. I do assessment, now we're on diagnosis. How are you going to diagnose this patient as the provider? So they come to you, they gave you those presentations. In your mind, you should already be thinking, ooh, girl, I got it. This sounds like classic cholecystitis, but I need to be sure. They're pointing to that right upper side, gallbladder, it's sounding like it. So what are you going to do? All right, one of the things that we do initially, and especially, I'll get into all that, but one of the things we want to do is the Murphy sign. All right, Murphy sign goes with cholecystitis. So what you're going to do is place your hand as the provider under that right subcostal region. The what, Brittany? Under the right rib cage, okay? Right under that right rib border. Right subcostal region, know your terms. But you're going to place your hand there and have your patient to inhale. As they inhale and your hand is pressing right in that right subcostal region, if it's positive, the patient will grimace, whisk with pain, they'll have pain, okay? And that's a positive Murphy sign. Classic for confirmation for that cholecystitis diagnosis that you were already thinking. Next, a few other things they may do. My family providers, my adult gero providers, if you're referring out, because in test, I know, listen, I've always worked in a hospital, so that was one thing that was difficult for a mind shift, because you start to think of all the things that we do. But for board's purposes, think of it, you're still in the office, so you can't do but a certain amount of things. So textbook, you're referring them out to have these things done. But I like you to know the things that need to be done, because if you're acute, you need to know to do these things. But also, you need to know the next steps, just in case they put those that you're referring for X, Y, and Z, right? So again, we're going to do the Murphy sign for diagnostics, but also CT scans can be done, MRCPs can be done, abdominal ultrasounds, because that's going to give us a better view of that bile duct, so we can see what's going on, see what's causing the blockage, see where the issue is. Also, HIDA scans are also done, because that kind of gives us a better idea of the flow of the bile also. So those are some other diagnostic exams that are done as well. Next, we want to evaluate and treat. So you're evaluating how the patient is presenting themselves. But when we start thinking about treatment, I like to say symptomatic management, because at first glance, you're going to have them fasting on an NPO diet, nothing by mouth, right? Because as I talked about previously, with the food, you're causing more stress on that gallbladder. So you want to give that gallbladder some rest. So that may warrant them to have IV hydration. But again, we want to limit the stress. So NPO diet for a small period of time as we work through these stages of treatment. They may also need an NG tube that can help with the release of that bile as well, help to decrease that nausea and vomiting. Also providing analgesics just for those the pain that they may have, the intermittent cramping and such. Again, symptomatic management, we're treating the patient. Now, if it progresses and is anything that may warrant, the removal of a gallstone, like an ERCP, looking at those further issues, or a cholecystectomy to actually remove the gallbladder may be warranted. But again, those are the treatment options, so you need to be able to maneuver through each one of those steps, okay? So real briefly, we know what cholecystitis is, right? It's the inflammation of the gallbladder. We now know why we're having that inflammation, because we're retaining that bile. We know that our gallbladder is in the right upper quadrant, so you will have right upper quadrant pain. We know our first thing we do diagnostic-wise is that Murphy sign, where you're going to place your hand under the right subcostal region, having your patient to inhale. If they have pain, that's a positive sign. They may also get an abdominal ultrasound, CT of the abdomen, MRCP, or HIDA scan for further diagnostics. We want to evaluate how the patient is doing, their pain, their nausea, their vomiting. We want to do treatment, symptomatic management, having an NPO diet, keeping them hydrated, maybe needed intravenously, and if surgical options are warranted, we will do so, okay? But I want to give you that, but let's get into the next few. That's cholecystitis, and like I said, next we'll cover appendicitis, and then we'll move on to pancreatitis and diverticulitis. All right? Follow me. All right, so appendicitis, same as when we're talking about cholecystitis. Use your med terminology. Itis meaning inflammation. We're talking about inflammation of the appendix. Same here. What's causing that appendix to be inflamed? There's a blockage here too at the opening of the appendix. Something is causing a blockage, which is leading this to be inflamed. Now, with the appendicitis, we want to start, my normal routine: assessment, diagnosis, evaluation, treatment. How will they present themselves? So with appendicitis, same. They're going to have that intermittent pain. The appendix is located in the right lower quadrant, so they're going to have right lower quadrant pain. But with the appendix, sometimes people often will present with pain at the belly button first, the umbilicus, and then working its way down. They may say like a shooting pain. It was like around my belly button, and now I really feel it in my... They're not going to say their right lower quadrant, but they'll point to the right lower quadrant where that pain is. And that's going to alert us to move forward with our diagnostic exams. With this, you want to assess for rebound tenderness, as this patient is laying flat and you're assessing them as they're talking about their symptoms. You'll kind of see if they're guarded. You can check for rebound tenderness, slightly gradually palpating the abdomen and seeing if they're having any pain in that region. Something that is common, the common point with appendicitis is that McBurney's point in the right lower quadrant of the abdomen. If they're having pain there, that's positive for the McBurney's point for appendicitis. So make sure you're knowing that McBurney's is associated with appendicitis. Again, tomorrow when we cover those areas and location, that'll be more helpful for you to remember. The appendix is in the right lower quadrant. McBurney's point is at the right lower quadrant. So it'll all add up and make sense, right? So again, doing that rebound tenderness, seeing if they're guarded, Of course, there's other exams that are utilized as well. Again, I try to break it down for what we're doing in office and then what may exceed. So they can have those abdominal ultrasounds, abdominal x-rays, MRIs, etc. to further confirm the diagnosis of that appendicitis. Now, other tests that can be done as well is the obturator and suicide. We also have Rovsing sign. So with the obturator, suicide, so obturator and all this, you know, if the appendix has ruptured, that infected pus, so to speak, can begin to go down more into that pelvic region, affecting the muscle, that obturator muscle. So we do like our exams for that. So with the obturator sign, you will have the patient lying flat. You will flex that leg to the knee at a 90-degree angle and move the leg inward. It'll elicit pain if that muscle has been affected. Suicide, the patient will be lying on their left side and you will extend, just pull that right leg back, and then they'll have the abdominal pain as well with that if it's positive. And then Rovsing sign is another exam, and that's where we're going to palpate the left lower quadrant, and when doing so, it'll elicit pain on the right lower quadrant, which is also confirmation for the diagnosis of appendicitis. And typically, one, you're going to do symptomatic management. You're going to want to control the pain, but typically appendicitis is treated with surgery, and they have an appendectomy to remove that actual appendix. Antibiotics are typically given prior to, because it's most likely infected as well. Okay. All right. So next we'll get into pancreatitis and then diverticulitis. All right, you guys. So pancreatitis, again, knowing your medical terminology, this is simply itis, inflammation. So the pancreas is inflamed. Why? There are various causes for inflammation of the pancreas. It could be due and secondary to gallstones, alcoholism, medications, trauma, various things can lead to that pancreatitis. Okay. So we want to know, of course, as I always say, the assessment for how they may present themselves. So as everything else, they're going to have that abdominal pain. But here is a bit different from what I've been telling y'all already, you know, where it might be right upper quadrant pain, right lower quadrant pain, etc. With this, you know, I always say, think of the location, and it still is, it rings true for this as well, but it's a little bit different because the pancreas overlaps quadrants, right? So when you think about it, the majority of the body of the pancreas is in the left upper quadrant, and then a small portion of it is also in the right upper quadrant. Well, you know, none of your patients are coming to you saying, a little bit over here in the left upper quadrant, some to the right upper quadrant. No, none of that. So they're going to just commonly say, hey, I have abdominal pain, you know, but they'll usually kind of guard that upper region. Typically they may have some nausea and vomiting. Symptoms will be more so related to that cause and what is secondary to. Okay, so thinking of that, remembering your whys, but overall it will be abdominal pain for the pancreatitis. Also, something that you may see that is good for diagnostics is what we call the Cullen sign. Cullen sign, they may present with that C-shaped bruising around the umbilicus. So the patient may present telling you that as well. I've seen some bruising around my belly button. And the way that we always commonly say to remember that is it's shaped like a C. C for Cullen's, that bruising around the umbilicus. All right. And then lastly, for treatment options, because the cause can be various, you're going to treat what is causing, what's the underlying source of this pancreatitis. So, you know, you want to try to do NPO because like when I talk about like the gallbladder, gallstones could be contributing to this. Same as we talked about with cholecystitis. So just giving that area a rest. You do want to check lab values, glucose, because you could have issues with your pancreas. You do want to check your liver function test because it could be related to the liver. Checking that amylase and lipase, it will be elevated. Also, they may do CT scans, abdominal ultrasounds, MRIs, etc., to also look more so at that region. But again, with the treatment options, NPO, eliminating alcohol consumption, because alcoholism is a very common risk factor for pancreatitis. Monitoring the medications they're on, doing IV hydration if it is warranted and they're needing to be, hospitalized, but maintaining their hydration. Also, surgical interventions if needed based upon those various causes. But as with everything else, we want to do symptomatic management, so analgesics for pain management, as well as if we need to do any antiemetics if they're having nausea and vomiting, we'll do so as well. Okay, so that's pancreatitis. And then lastly, let's get into diverticulitis. Okay, you guys, lastly, let's get into diverticulitis. We've done it all day. So, inflammation of the diverticulum. This is typically caused by an infection. So, one of the main causes that it is said to be due to is a low fiber diet. And I remember when being in school, I'm sitting here like, what? How did a low fiber diet really cause all of this? Like, what is the true? I'm a wild girl, so I go down a rabbit hole to figure all this stuff out. But interesting enough, they say it to be that a low fiber diet, your body is having to work harder to push stool through, causing that stool matter to go into the diverticula, and then it becomes infected, which leads to that inflammation of the diverticulum, leading to diverticulitis. Crazy, right? But anyhow, they present with abdominal pain, typically at the left lower quadrant, because the diverticulum region is in the left lower quadrant. They may have bloating, they may have flatulence, they may have nausea, they may have vomiting, all of those similar abdominal pain issues. You may see the abdominal distension slightly due to the bloating in that region. They do CBCs to evaluate pressure and physical exams of that pelvic region in that left lower quadrant to see of any guarding, any tenderness upon palpating the area is also key for diagnosis. Like I said, they do a CBC and they may do a CT of the abdomen as well for further diagnostics. Treatment, we're going to do our antibiotics. You're going to do your things like your Cipro, your Flagyl, your Bactrim. Those are the most common ones you see for the treatment of diverticulitis. I really often see Flagyl utilized for this as the first line therapy. Always checking for any allergies with your patient. Again, symptomatic management, so any analgesics for pain. You want to tell them to promote a high fiber diet, things, high in fiber. Then you want to do increase your fluid intake of your water. Also, irregular exercise. Smoking can also be a cause. So smoking cessation, if this is something, if that's a risk factor for them. And again, symptomatic management. So if any surgery is warranted for any structural issues noted on the CT of the abdomen, then that's all that is warranted for the diverticulitis. So I know that one's kind of short and sweet, but I want to run back through that again. So the diverticulum is inflamed, most commonly associated with a low fiber diet, but there are other factors that can contribute to that: obesity, smoking, etc. An infection is that underlying cause. So you do want to do a CBC. CT of the abdomen can also be done. Patient will present complaining of abdominal pain, typically in that left lower quadrant. They may have bloating, abdominal distension, nausea, vomiting also. You want to do symptomatic management for treatment, treating that pain if they're having it with analgesics, any antiemetics if needed for the nausea or vomiting, and encouraging increased fluid intake and high fiber diets to also do this, and then tobacco cessation if they are smokers. Okay, so that is it for diverticulitis. I hope that y'all have found this helpful for today, because I know it's a lot. Abdominal pain is one of those things that is just like, oh, this could be a number of things. So I wanted to highlight 4 of the common ones. It's more, y'all, but 4 common things, breaking it down by the quadrant. Again, tomorrow you'll also see some videos where I give you the breakdown with the quadrants and ways to kind of remember that, to kind of help you with that. But today I really wanted to get to the foundation of all of those, to know why, what are the causes of it, how they may present, what signs and different diagnostic exams we do, and how we treat. I hope that you have found this helpful. If so, be sure to like, comment, subscribe, and share with a friend or colleague who may find this helpful as well. This helps with the promotion of the videos so that other people can see it. And give me some feedback. If you have any questions or want me to cover something, please comment. I'm happy to do so. And you guys, I have an upcoming course starting for the month of June. So look for the link for that as well. All right, you guys, enjoy the rest of your day. And I'll meet you back here tomorrow for more tips on how to retain the locations of all 4 of these that we discussed today. Bye, y'all.